Hello and welcome. I'm Matthew, your librarian for the San Marcos campus. I'd like to welcome you to today's session on the Healing Voices, Native Peoples Health Information. Racism and colonialism continue to be a very powerful force in society, with systemic consequences that affect millions of lives in the United States. They even play a considerable role in medical research and evidence-based medicine. This session is designed to provide a starting point to advance the discourse and practice toward health equity for all patients and communities. We will do so here in this moment by identifying resources available through the library and elsewhere to support the journeys of students and faculty alike. The agenda of this session is to identify key eBooks and scholarly journals available on the topics of Native, Indigenous, and tribal health, search tips for finding relevant literature for your evidence-based practice, ways to contextualize your research approach and design, and other resources available for health researchers and clinicians practicing inclusive research. Before getting to know these resources, I would like to briefly emphasize the importance of this work. It's important to realize and acknowledge how racism, especially towards Native, Indigenous, and tribal communities, is not only in the personal spheres of our lives, such as prejudice and actions of hate, but also in the routines and policies of institutions, including healthcare. Systemic health disparities are one such manifestation of racism and colonialism at the institutional level. Indigenous peoples experience the highest health disparities, with poor health outcomes and healthcare barriers linked to socioeconomic and educational disparities, as well as racial discrimination. As you contextualize your position as a clinical researcher engaging with Indigenous communities, especially if you are non-Indigenous yourself, it is important to understand that several tribal nations have their own IRBs and research data protocols to observe. Also, the use of oral history as evidence can be vastly important for the transmission of knowledge within Indigenous communities, but it is easy for it to be misused if it is quoted or used out of context, more so as the United States has an extensive history of misusing Indigenous information and knowledge. You also need to involve the community that you're wanting to conduct research with from the very beginning of your research process, and understand that community engagement might involve both the formal communication, such as the IRB process. For example, a community member might have told you to check in on a couple people to see if they're interested in chatting with you in regards to your research. Last but not least, it is necessary to practice cultural humility and intersectionality in developing and conducting your research. Through the library, you have comprehensive access to a wide variety of eBooks that focus on Native, tribal, and Indigenous health, as well as culturally competent research practices and ethics. Therapeutic Nations, for example, is the first book to demonstrate affect and trauma's wide-ranging historical origins in an Indigenous context, offering insights into community healing programs. The author's theoretical sophistication and original research make the book really relevant across a range of disciplines as it challenges key concepts of American Indian and Indigenous studies. Red Medicine explores Indigenous medicine across North America with a special emphasis on how Indigenous knowledge has endured and persisted among Indigenous peoples, with in-depth research into oral traditions, storytelling, and the meaning of symbols to uncover how Indigenous knowledge endures over time. The book, Coming Full Circle, is an interdisciplinary exploration of the relationships between spirituality and health in several contemporary Indigenous communities in Western Washington, spanning a couple centuries. The author examines how these communities define what it means to be healthy and how recent tribal community-based health programs have applied this understanding to their missions and activities. The author also explores how contemporary definitions, goals, and activities relating to health and healing are informed by the community's history and also by indigenous spiritual views of the body, which are based on an understanding of the relationship between self, ecology, and community. Coming Full Circle draws on a historical framework in reflecting on contemporary tribal healthcare efforts and the ways in which they engage indigenous healing traditions alongside 21st century biomedicine. Diagnosing the Legacy is the story of communities, researchers, and doctors who faced and continue to face something never seen before: type 2 diabetes in younger and younger people. Through dozens of interviews, the book shows the impact of the disease on the lives of individuals and families, as well as the challenges caregivers face diagnosing and then responding to the complex and perplexing disease, especially in communities far removed from the medical personnel and facilities available in the city. As emerging and experienced clinicians, the need for evidence-based practice often calls for searching through scholarly databases to find evidence to substantiate good clinical decision-making. PubMed, among other databases, are among the more popular databases of this caliber, and for good reason, as they focus on topics and issues of health and medicine. So it is essential to develop knowledge and skills to maximize your search, so as to find the literature that includes the experiences and needs of marginalized populations and communities. Learning about how PubMed organizes articles based on race, ethnicity, and culture is one such skill. MESH terms, known as medical subject headings, are subject categories and labels assigned to each article in PubMed to best describe what the given article is about. These terms are assigned by the National Library of Medicine. The terms come from the National Library of Medicine's official thesaurus of words and phrases to best represent different concepts and elements of the scholarly literature. For example, an article about heart attacks would be assigned the official MESH term, myocardial infarction. However, it is important to remember that new MESH terms can be introduced to replace older, outdated terminology. However, this process can be slow and may not be able to reflect the changing landscape of terminology, especially when it comes to topics like race and other population or society-related concepts. So you may find yourself having to use outdated and sometimes even offensive terms to find older literature. You may also find that using more current terminology limits your results to only recently published literature. Here presented is the list of recommended MESH terms to consider when searching for native, tribal, and indigenous health in the medical literature. However, you may realize that some of these MESH terms may be too broad or do not exactly pertain to your specific population. For example, you might miss out on nuances in certain indigenous communities. There are known MESH terms, for example, when it comes to specific indigenous community names, like the Cherokee or the Navajo, or even other native language names. Indigenous peoples or American Native Continental Ancestry Group might be the preferred MESH terms in this case, but you can still use keywords such as Cherokee, Navajo, and their native language names to narrow the scope of your search results in combination with appropriate MESH terms. There are other resources to be aware of as you engage in research or clinical work with indigenous communities. Here are a few highlighted to discuss, such as the Finding Answers Intervention Research Database, the Native Health Database through the New Mexico Health Sciences Librarian Informatics Center, ClinicalTrials.gov through the National Library of Medicine, the Native Voices exhibit that's available online, MedlinePlus, as well as DynaMed. The Finding Answers Intervention Research Database, also known as the FAIR database, is a searchable tool containing 388 journal article summaries distilled from 11 systematic reviews of the published health disparities literature. The database allows individuals to find targeted research that applies to their content of interest and specific to their patient population, disease, and intervention. Use this database to generate ideas for disparities reduction interventions and to collect ideas of research questions and interventions that have already been explored. If you're interested in any of these articles, you can also access the full text through the library's databases. So you can just simply copy and paste the title over into SearchUSA or into Google Scholar to find it available through the library, or if it's not available, you can request it through interlibrary loan. The Native Health Database contains bibliographic information and abstracts of health-related articles, reports, surveys, and other resource documents pertaining to the health and healthcare of American Indians, Alaska Natives, and Canadian First Nations. It was developed by the University of New Mexico Health Sciences Library and Informatics Center with funds made available by contract with the Indian Health Service. The database provides information for the benefit, use, and education of organizations and individuals with an interest in health-related issues, programs, initiatives regarding North American indigenous peoples. The database entries cover a time period from approximately 1970 to the present. The database is updated on a regular basis, usually at least once a month. And again, much like with the FAIR database, if you're interested in any of these articles, you can easily copy and paste the title into SearchUSA and access the full text through our databases, or you could also request it through interlibrary loan in case the full text is not immediately available. ClinicalTrials.gov is a registry and results database of federally and privately supported clinical trials conducted in the United States and around the world. Clinical Trials gives you information about a trial's purpose, who may participate, locations, and phone numbers for more details. The Native Voices, Native People's Concepts of Health and Illness, is an exhibit that was curated by the National Library of Medicine in conjunction with Native and Indigenous advisors as a way to explore the interconnectedness of wellness, illness, and cultural life for Native Americans, Alaska Natives, and Native Hawaiians. It also includes resources that are specifically about careers in medicine and sciences, lesson plans as well, online activities, suggested readings, online health information available for and by Native Americans that you can find here as well, including locally curated or including indigenous curated resources as well as resources provided by the U.S. government. MedlinePlus, which is information developed and curated by the U.S. National Library of Medicine, presenting high quality, relevant health and wellness information that is trusted and easy to understand. A particular note, you can gain access to information about cultural, racial, and ethnic groups in addition to other populations. These population profiles include encyclopedic information, statistics, research, and other relevant information regarding that group. DynaMed serves as an online point-of-care reference tool. Rather than connecting you with published articles and journals, DynaMed connects you with encyclopedic entries about conditions that include an overview, diagnostic information, and recommendations for treatment based on published evidence. I want to thank you for joining me on this session about Healing Voices, Native People's Health Information. I hope you have learned something new and useful. Thank you.